to Unit 11 of our medical terminology course. This is the respiratory system. In this unit, we're going to be talking about the anatomy of the respiratory system. We're going to get to know some new word parts related to respiration. We're going to take our time and break down a whole bunch of new terms related to the respiratory system. We will talk about some common diseases. And last but not least, we will take a look at some abbreviations related to respiration. The anatomy of the respiration system is important to learn in this particular course because you really need to understand some of the basic parts before you can put some words and some disease terms to them. So let's get started. All right, so we're going to talk about this in terms of a couple of different components, but let's take a look at some of the different pieces of the organs of respiration. Okay, let's take a look at our head, which is where respiration starts. First up, we have the nose, and that's the external portion of the stuff we see from the outside. Hopefully you can all identify the nose. We've known it for some time. However, just behind that, we have this open space, and we call an open space inside the skull a cavity. And so that little open space where the air goes into the skull is referred to as the nasal cavity. Further towards the back, it kind of straightens out. It becomes this portion we call the pharynx. And the pharynx is really just a fancy way to refer to the throat. Next up, we have this little flap at the top, which we're going to see again, but this little flap underneath the tongue as it heads down into the lungs is referred to as the epiglottis. Epiglottis is how you pronounce that. Okay, let's take a look at some word parts that are associated with each of these. So first up, the nose or the nasal cavity has two potential root terms that we are looking at here. The first is naso, N-A-S, with the combining vowel O, which should be fairly obvious. The other one that might be less obvious is rhino. Rhino, R-H-I-N-O, refers to the nose. Altogether, this portion that stays from the epiglottis and higher is often referred to as the upper respiratory system. So if you have an upper respiratory system cold, it's something that kind of just stays in your nose, that nasal cavity, maybe just the upper portion of your throat. So the upper respiratory system. Okay, our next picture here should be a little bit obvious. Hopefully you recognize these as the lungs. But we're going to start right out at the top. So the very top portion underneath that epiglottis, so that little flap from the side, okay, is called the larynx. The larynx. It is, if you look at your word list, you will see that the larynx is actually your voice box. So right behind that top piece that we're pointing to up there in this picture, you see that larynx or that voice box is housed behind there. Moving down, we have the trachea, and the trachea starts at the top of the throat, so just underneath that jawbone, but goes all the way down into your chest. And if you look at your word list, you will see that the trachea is usually just defined as the windpipe. We're going to use the trachea now as medical professionals as the proper term for the windpipe. On this side, we have our right lung. And our right lung is divided into 3 lobes. So you can see 3 separate sections here that are sort of outlined. And this side is the left lung. And the left lung only has 2 lobes associated with it. And the reason that the right lung has 3 lobes, but the left lung only has 2, is because our heart lies much further on the left side, so there has to be some room for that. So there is a little bit less space in the left lung compared to the right. Next up underneath is this little muscle that is the diaphragm. That's called the diaphragm. So that is the muscle that is located underneath the two lungs. It separates that thoracic cavity or that chest cavity from the abdominal cavity, right, or that stomach portion. But its primary function is not just to keep those two things apart, but to help us breathe. Okay, let's take a little bit of a closer look at the chest wall here. So there are some things that kind of outline the lungs, and what that is are the ribs. Okay, there are 12 ribs that are from top to bottom of the lungs. And in between each of those ribs, we have some muscles that hold those ribs together. They're also going to help a little bit with breathing. Those are called the intercostal muscles. Just like most of our organs, there is a tissue that surrounds the outside of the lungs. Okay, in this case, it is no different than the stuff that houses the outside of the heart or any other organ. It is double layers, so it is 2 layers with a little bit of fluid in between. The tissue that surrounds the lungs, however, is given its own term, and that is called the pleura. The pleura is the name of the tissue that surrounds and protects the lungs. Because there are 2 layers, the outer of the 2 layers is referred to as the parietal layer, and the one that lines up against the organ is referred to as the visceral layer. Okay, let's take a look at that trachea in some further detail, and we're kind of taking away the lungs here in this particular picture so that you can see and follow that trachea all the way down and what's really happening inside the lungs. Obviously, most of this is microscopic. We're sort of blowing this picture up for bigger effect. So again, I'm going to repoint out the trachea here, which is the proper term for the windpipe, okay, as it comes down, and of course we've removed the lungs. So as it hits into the chest, so just beyond the first couple of ribs, into your chest cavity behind the sternum, it is going to split, one towards the right, one towards the left. This very first split off the trachea is referred to as the primary bronchi. Okay, the primary bronchi. And again, primary is just a fancy way of saying the number 1. Okay, so the first time this trachea splits, it is referred to as the primary bronchi. It is going to split further, okay, when it splits a second time, okay, inside each chest. So I know I'm showing only on one side, but it's actually on both. So when it splits a second time, we refer to that second set of splits as the secondary bronchi. It will split a third time, and we are going to call all of the third splits, not just the singular arrow that I'm pointing to, but every time it splits the third time, as the tertiary bronchi, and tertiary is a fancy term for the word 3, okay, so a third split. At that point, we're going to start splitting an awful lot, so we don't continue on with this first, second, and third split sort of naming convention, but because we're splitting so many times, okay, those little bronchi have to become small. And so those bronchi after the third split are referred to as the bronchioles. Okay, so every split beyond that is a bronchiole. Each of those bronchioles ends, and where a bronchiole ends, we call it a terminal bronchiole, because to terminate means to end. So where each of those little bronchioles ends is a terminal bronchiole. And while I have only drawn in one here, realize that there are millions of these because there are millions of bronchioles that terminate and end in this. And again, this is just a picture format, so I am showing you one example. Okay, but this is something we call an alveoli. And an alveoli is the location at the end. They look like little grape-like clusters, or sacs at the end is how they're often described. They are surrounded by capillaries, and it is where we move oxygen into and out of the lungs, okay, and the blood vessels. So the trachea, those three bronchi split, the bronchioles, the terminal bronchioles, are the portions of the lungs that are really just deliver oxygen down to those alveoli, which is where oxygen is actually put into and out of the body. All right, everything from this point down is usually referred to as the lower respiratory system. So a lower respiratory infection is usually something that's more associated with the lungs, the trachea, those bronchi. All right, let's put the parts of respiration in order. So we've talked about all of the pieces. We've started with the nose, we got all the way down to the alveoli, but let's put them in order together. Okay, so first up officially, airflow starts through our nose. I realize some of us do breathe through the mouth, but we should be starting our respiration through the nose. Next up, it goes down the throat or the pharynx, past that voice box or that larynx, and into that trachea or that windpipe. So this is where we're starting to see until we hit the trachea, right? So the top of the trachea is considered upper respiratory. When it gets down into the chest cavity or the thorax, we will be moving into lower. From the trachea, we're going to split the first time, and we call that first split of the trachea the primary bronchi. We call that secondary split the secondary bronchi. And when it splits a third time, we refer to it as the tertiary bronchi. We then split thousands of times, and so we refer to it as the bronchioles. When they end, they are the terminal bronchioles. And each of those terminal bronchioles end in that little grape-like, sac-like ending that are surrounded by capillaries, which is the alveoli. Okay, once we hit the chest cavity, okay, in the trachea, we consider that to be the lower respiratory system.